Throughout history, humankind has prevailed in our darkest moments, coming together to face the very thing that would extinguish our light. This is not one of those moments at all. This is a moment for pretty much the opposite. For hiding, for laying low. Napping is also good. Saving humankind by really not getting near it. Where playing games, staring at screens, staring at anything, all are the stuff of heroes. Every generation has its moment, where individual sacrifice makes way for the good of those who will come after. A higher purpose. This one is ours.
Hi, my name is Mr. Benji, Cultural Ambassador and lead singer for TK International. COVID-19 has hit my livelihood very hard. No large crowds means no shows. No live performances means no zero. I want to get back to doing what I love, to what you love. Let's get back to 13. I can only get back on stage if we all take the vaccine. Get vaxxed. Mr. Benji said so.
I did not imagine that the prayers of my country would have been answered so swiftly.
Vaccine. Under COVID pressure in we country, mentally, socially, economically. Look, we get a blessing rather quickly to bring us back to some kind of normalcy. Yes, you over 18. Take the vaccine to protect your family. Take the vaccine to safeguard the elderly. Take the vaccine to bring back with festivals. Take the vaccine. Take the vaccine. Take it. Take the vaccine. Need it. Take the vaccine. Take it. Take the vaccine. Need it.
This is a message from Tasha P. and the Health Promotion Unit of the Ministry of Health, Dominica.
Hey everybody, it's your boy Mr. Benji, and I'm here to tell you about the COVID-19
Good evening
video competition.
and welcome to this August 27th COVID-19 press briefing. I am Vanilla Ole, the Communication Officer within the Ministry of Governance, Public Service Reform, Citizen Empowerment, Social Justice and Ecclesiastical Affairs. Our presenters this evening are Mrs. Terilia Ravalier, the Acting Principal Nursing Officer, and Dr. David Johnson, the Chief Medical Officer. Presentations this evening will focus on two key areas: the COVID-19 care complex at Portsmouth and health protocols for selected businesses. So to get this evening's briefing started, I would like to welcome Mrs. Terilia Ravalier.
Chief Medical Officer, Dr. David Johnson, Moderator, Ms. Ole, media, and listening public, pleasant good evening to all. The COVID-19 care complex in Portsmouth. Let's begin with an overview. The Dominica government, through the Ministry of Health, Wellness, and New Health Investment, has consistently taken all essential public health steps to protect against the devastating threats posed by the COVID-19 virus. More specifically, with the recent spike in cases, there has been a significant rise in efforts aimed at preventing the spread of COVID-19 infections and minimizing the pandemic's negative impact on Dominica. As a result, one of the steps taken was to expand the government quarantine facility to create the COVID-19 care complex. This facility basically is a collection of retrofitted facilities located in Portsmouth, dedicated to isolating and treating people who have been diagnosed with COVID-19. Noteworthy, based on the current COVID-19 health protocols, isolation in a health facility is recommended for persons who are unable to self-isolate at home for various reasons. I now move on into an update of the COVID-19 complex. The care complex in Dominica's largest and most centrally located healthcare facility is dedicated to the treatment of COVID-19 patients. It is equipped to accommodate patients with COVID-19 symptoms ranging from mild to severe. For the period July 25th to August 26, 2021, the facility manages an average of 406 patients on a daily basis, with an average of 67 patients being admitted per day. To date, this is August 27, there are 417 individuals admitted to the different units, 124 of which who have moderate to severe symptoms and 293 with mild symptoms. Staffing at the facility. The COVID-19 care complex includes a network of 9 facilities run by a group of competent and dedicated nursing and medical personnel. Overall, there is a skill mix of medical and non-medical personnel who go above and beyond call of duty and operates on 12-hour shift to ensure that the highest quality of care is delivered to the patients. Support staff, such as the orderlies, domestic workers, and drivers, as well as a team of logistics personnel from other government ministries, all contribute to the smooth operation of the facility. A call center has been established, and it is staffed by employees from the complex to reply and assist patients with any questions or concerns they may have. A nutritionist has also been hired by the government to aid in the provision of nutritional meals to the patients and staff alike. In recognition of the critical role that data management plays, a team of data management personnel has been engaged to ensure that timely and reliable data is available to aid cabinet decision-making as well as immediate public health action. The clinical management at the complex. Infection prevention and control is a critical and integral part of the clinical management of patients, and therefore it forms part of the entire process from admissions to discharge of patients at the 9 facilities. A wide range of patients across the life course are seen. For example, children, adolescents, adults, pregnant women, and the elderly are all included. It has been noted that a high percentage of patients admitted suffer from chronic non-communicable diseases such as diabetes, hypertension, heart disease, and chronic kidney diseases. Patients who are mentally ill or who are bedridden are also cared for at these facilities. Additionally, the severity of signs, symptoms, and the incidence of risk factors for severe COVID disease are used to categorize the patients. This simply means that medical staff monitors patients with moderate to severe symptoms on a regular basis and tailors a treatment plan for them. While patients with mild symptoms are also monitored by the nursing and medical personnel, and these patients are instructed to report any changes in their health status as soon as possible. All patients receive medications such as vitamins and other treatment necessary for their swift recovery. In addition, patients are provided with free nutritious meals on a daily basis. No visitors are allowed at the facilities. However, we accept drop-offs of items to patients which are subject to inspection by the security team. Many drop-offs, though, we have noticed, usually are medications. Therefore, I am encouraging persons who are for admission to the facility to kindly travel with their maintenance medications and their health books. At this point, I would like to take the opportunity to express gratitude, foremost, to the government of Dominica, more so the cabinet personnel and the Ministry of Health, Wellness, and New Health Investment. I must admit, they have been acting aggressively to stay ahead of the pandemic. They have been truly steadfast in providing support and leadership in the management of the entire operation. Importantly, we have been spared from the harsh realities of the deaths that other countries have faced as a result of efforts of the medical team, and they must be applauded. The medical doctors, the nursing personnel, wardens, the orderlies, thanks for your devotion to the work and operation as a noble team. Thanks also is extended for the remarkable support of other allied workers, such as the drivers, domestic workers. Your work does not make this task less meaningful to us. Our logistics personnel from other ministries and organizations, we thank you for getting the work done from the ground level. We do appreciate all your efforts and keenness. To the community of Portsmouth and environs, thank you for your hospitality. You have opened your doors to us. To all our generous donors who have given so abundantly in kind, I say thank you. To the listening public and more so patients at the facility in Portsmouth, as the coordinator for these facilities, along with my dedicated team, the Ministry of Health, Wellness, and New Health Investment, and the government of Dominica, let me assure you that we will continue to provide optimum care to the best of our ability. I would also like to implore your cooperation. Your health care and well-being is our priority. To the patient, we understand that you are not at home. There may be some minor inconveniences that may affect one person or the other. However, we will continue to listen to your suggestions and work to continuously improve the services that we provide. I will end with this. Please do not underestimate the risk of the serious consequences of this virus. COVID-19 has claimed many lives globally and will continue to take the virus home to our elderlies, our children, and others who are vulnerable and more susceptible. Let us all work to protect ourselves and others by following the recommendations and guidelines of the health team. Wash your hands regularly. Wear a mask appropriately. Maintain distance of 3 feet or more. Clean frequently touched areas. As the principal nursing officer and coordinator operating from the grounds level at the COVID-19 care complex, there is this idiom, seeing is believing. On that basis, I want to encourage all the nursing personnel and other frontline workers, and you, the listening public, who have not been vaccinated, to please get vaccinated against the COVID-19. And finally, we humbly ask for your continued support at the COVID-19 care complex as we work together to achieve best results by caring for all your patients and hoping that everyone returns home safely to their lives, their friends, and their families. I thank you.
Thank you, Mrs. Ravelier, for such a comprehensive and detailed presentation. At this point, I would like to welcome Dr. David Johnson, the Chief Medical Officer.
Thank you, Madam Moderator, Ms. Ole, our Principal Nursing Officer, Ms. Ravelier, to you, the listening and viewing audience, good evening. The Ministry of Health, Wellness and New Health Investment confirms 3 new COVID-19 related deaths. Our second COVID death was a 70-year-old male with underlying condition who was admitted to the COVID isolation unit on August 8, 2021. This patient eventually tested negative on PCR and was discharged for transfer to the Dominica China Friendship Hospital. However, the patient subsequently succumbed to the illness on August 26, 2021. Our third COVID-19 death was a 78-year-old male with underlying condition who was admitted to the COVID-19 isolation unit on August 18, 2021, and he also passed away on August 26, 2021. The fourth COVID-19 death was a 74-year-old female with underlying condition who was admitted to the COVID-19 isolation unit on August 22, 2021, and passed away today, August 27, 2021. So this brings the total of COVID-19 related deaths in Dominica to 4. The government of Dominica and indeed the Ministry of Health, Wellness and New Health Investment extend deepest sympathies to the family and loved ones of the deceased during this difficult time. The ministry is encouraging the public to remain vigilant and adhere to all public health measures and protocols to protect us from the COVID-19 virus. I must emphasize the importance of protecting our elderly during this pandemic, as they are vulnerable and at high risk of developing severe symptoms from the COVID-19 disease. Managing COVID-19 pandemic is indeed complex for all countries. Every country is still grappling in finding the best way to do so. There is no perfect blueprint. Each country has to do a risk assessment of its situation and implement public health and social measures in keeping with international best practices. In lifting some of the restrictive measures during the state of emergency, which ended on August 23, 2021, it was necessary, I repeat, it was necessary to implement specific health protocols to allow business places to reopen and reopen safely. So this evening, I will focus on the health protocols in keeping with the recent SRO number 26 of 21 that came into effect on August 23, 2021. Business and establishments, and in fact, each and every one of us in Dominica must comply with the protocols to prevent the spread of COVID-19, to mitigate serious negative impact to the general welfare of the society and individuals, and to prevent further loss of life in Dominica. We have protocols for all business places in Dominica, but tonight I'll focus on health protocols specifically for owners and employees of barber shops, salons, pedicure, and manicure services. The owners and managers, operators of these business places should provide training, education materials, and enforcement on proper sanitation, hand washing, respiratory etiquette, use of appropriate protective equipment at their business places. Face masks and face shield must be worn by all employees while performing services. Washable, reusable face masks are not recommended for service providers. All customers should be accommodated by appointment only. Allow adequate time between the conclusion of an appointment and the beginning of the next appointment to ensure proper disinfecting practices. No one should accompany a client to an appointment. There should be no loitering at the place of business. Barbershop and saloons should take necessary action to limit gatherings in waiting areas prior to and following appointments to the extent necessary to promote appropriate social distancing. Remove all unnecessary, frequently touched items like magazines, newspapers, service menus, and any other unnecessary paper products from customer service areas. Remove them, please. You have to thoroughly clean and disinfect furniture and tools after each client. All surfaces, tools, and linen should be disinfected, even if the items were cleaned before the barber shop or salon was closed during the lockdown. You must do comprehensive disinfection and sanitation after you finish at the end of each day. Please, make sure that there is hand sanitizer with 70% alcohol or 70% alcohol and tissues for employees and clients to disinfect their hands at your business places. Employees must wash their hands with soap and water for a minimum of 20 seconds after you finish with one client and go and deal with another client. Wash your hands between clients, please. Make sure you wash or sanitize your hand well after you take money from a client. After you take money from a client, make sure you wash your hand or sanitize your hands properly before you go and deal with another client. Disinfect all door handles and other surfaces that are regularly touched by clients and staff with disinfectant wipes. Clean and disinfect all restroom surfaces, including floors, sinks, and toilet bowls. Clean and disinfect all reusable tools and appliances, such as your clippers, your guards, combs, brushes, etc. Store them in a tight and closed container. You have to erect station barriers between workstations. Erect station barriers between the workstation of your employees. Ensure break rooms are thoroughly clean and sanitized and are not used for congregating by your employees. Employees who are displaying flu-like symptoms, all employees who are displaying flu-like symptoms are to remain at home and contact the COVID-19 hotline. If an employee tests positive for COVID-19, you ought to immediately report it to the health authorities so that the required contact tracing and testing can be done for your employees and clients who were primary contacts. The Ministry of Health, and I repeat this, the Ministry of Health reserves the right to request the temporary shutdown of any business depending on the public health risks. The Ministry of Health reserves the right to request the temporary shutdown of any business depending on the public health risks. The Environmental Health Department will be carrying out periodic random monitoring of these businesses to ensure that they meet and they're compliant with the protocol. It's also important that the clients pay attention to the protocols and ensure that service providers follow the protocols for their own safety. It is important, it is very important that business owners and employees get vaccinated. We also encourage business places to have their employee know their status and get antigen tested. It is in the best interest of your business place to do that. Before I end, let me say this. There is sufficient evidence globally and including in Dominica that vaccination works. Vaccination against COVID-19 prevents severe COVID-19 infection, hospitalization, and death. The evidence is clear. Had it not been for vaccination, the impact of COVID-19 disease would be catastrophic. Yes, many people have all types of conspiracy theories about COVID-19 vaccines. But the conspiracy theories that I've heard of, they never ever tell us or show any evidence for what is better to control the COVID-19 disease. Should I repeat that? The conspiracy theories that I've heard of never ever tell us or show us any evidence for what is better to control the COVID-19 disease. In places like Iceland, where around 84% of their 12 years and older population are vaccinated, they have not experienced death in the last 3 months. For us in Dominica, we currently have the Sinopharm and AstraZeneca available to all 18 years and over, free to everyone. These vaccines, which are very expensive, are made available at no cost to persons getting them. These vaccines, the Sinopharm and the AstraZeneca, which we have currently on island, have been approved for emergency use by the WHO. And no one in Dominica has gotten any severe complications from these vaccines, and no one in Dominica has died from these vaccines. And with the current surge in COVID-19 cases in Dominica, no fully vaccinated person in Dominica, I repeat, no fully vaccinated person in Dominica has died from the COVID-19 disease. Whereas some persons might have genuine concern about side effects of vaccine, questions around the speed at which the vaccines will develop, or may think that vaccines will not protect them, the billion and billion of doses of vaccines that have been given globally showed very clearly that COVID-19 vaccines work. For elderlies, please don't think that you are too old to get the vaccine. I just want to share with you a personal story at a personal level. I can tell you that my 90-year-old dad took his 2 doses of Sinopharm, and not a single thing happened to him. My 87-year-old mom took the AstraZeneca, and nothing happened to her. But they also comply with the other public health measures, including hand hygiene and wearing a face mask. Our frontline workers are exhausted and going beyond the call of duty at great personal sacrifice to themselves and to that of their families. Whereas they advise their clients and the general public to get sufficient rest to build their immune system, or doctors or nurses or pharmacists and our frontline workers are hardly getting time to sleep. Just this evening before coming to the press conference, a senior staff came to me and told me that he just cannot make it again because he has not gotten a proper night's sleep in weeks. So I want to express profound thanks to all of those who are working tirelessly to bring the situation under control. I truly remain optimistic that we will get through this COVID-19 surge. And if we all get vaccinated and follow the health protocols, we can prevent a future surge of COVID in Dominica and deaths from the COVID-19 pandemic. I wish to thank you for your attention and good evening.
On behalf of the government of Dominica, I would like to express sincere condolences to the families and friends of all deceased. I would also like to emphasize the importance of following all health and safety protocols implemented by the government of Dominica. Just a reminder, the Ministry of Health short video competition, it is still available. You are still able to submit videos. The deadline for submission is Wednesday, September 1st. Our focal point, as mentioned, get vaccinated, get tested, or you could simply focus on any of the health protocols implemented by the government of Dominica. We all have to do our part in this fight against COVID-19. Thank you for tuning in. Good evening. Hi, are you looking to be part of the COVID-19 battle? Are you tech savvy, own a mobile device, and creative? If this sounds like you, here's your chance to win an attractive cash prize from the Ministry of Health, Wellness, and New Health Investment in our COVID-19 short video competition. Simply create a video up to 1 minute long, encouraging your peers to get tested, get vaccinated, or just to promote the health and safety protocols. All video entries should be submitted to the Ministry of Health at our email address at healthp3@gmail.com and will consequently be uploaded to the Ministry's Facebook page. And then the competition begins. The video with the most likes and shares will win. Visit the Ministry of Health's Facebook page for further details. Remember, we are all in this together.